white line. And we've already gone over dehiscent and visceration. So these are more terms for you. So what is thin, clear, watery secretion? I gotta put up my screen. Yes. So it's serous. Containing pus. Yes. Open cut made with a knife or a scalpel. Yes. Containing RBC. Sanguinous, correct. Irregular wound, tears, jagged edges. So it's a laceration. Entering into the tissues. Body cavity. Yep, penetrating. Goes on with pain, swelling, and discoloration.
Very nice.
This is with pain. Well, yes, it's two. Contusion. Everyone has that because a couple people have put in 4. It's contusion. Red watery secretion. Serosanguinous, correct? A scraping away of the skin surface. Abrasion. For the people that thought a close wound with pain was abrasion, do you see the difference why the last one is abrasion and the other one is contusion? Okay. So then this is telling you the different diets. So if you have a patient that's on a regular diet, they have a standard diet consisting of appropriate servings and foods from all food groups. So they're not restricted. You don't have to worry if they're on a low carb, or they can't have a lot of sugar, salt. A soft diet is soft, consists of foods that are easily chewed and digested, and they're low in fiber and fat. If you have someone that's on a full liquid, it consists of foods that are liquid or liquefy at room temperature, such as puddings, yogurts, custards, low protein calories. Can we turn what?
So there's somebody that has a lot of background noise. If you're not muted, please mute yourself and unmute if you need to speak.
Sorry, I was gonna say. So like full liquid, the ice cream is an example because it can melt. And full liquid, you cannot see through it. Like clear liquid, you can see through it. Tea, coffee, clear broth, the carbonated beverage like ginger ale, popsicle, gelatin, and puree. The consistency of the food changed by the process of straining or blending. And I got this stuff from the Yost book, so if anyone's. So, out of the A through F, which actions are performed under surgical asepsis? Would you, let's see, put this up so next second. Keep soiled linens off the floor, avoid shaking linens, teach patients the proper use of tissues, avoid coughing or reaching across the sterile field, keep all items above waistline in your sight, pour liquids directly into the drain to avoid splashing. Those that select all, so there'll be more, yes. E and E are correct. So you want to avoid reaching across your sterile field, and you always want to keep everything above waistline. You always want to have your eyes on your sterile field, so you know if anything contaminates the field. The single most important technique to prevent and control the transmission of infection is hand washing, the disposal of gloves, the use of isolation precautions, sterilization of equipment. Yes, hand hygiene is number 1. So, what is standard precautions?
precautions you want to use with everybody, regardless of the situation.
Right. So, and if someone else put you want hand washing and you use gloves. So it's what you use for every patient. What would be droplet precautions?
Rubella for
So
rubella.
mask. So if somebody has I'm trying to think, the flu, they have droplet, so you wear masks. What is airborne precautions? Yes, you have to wear N95, TB, COVID-19 is another one that's airborne. So they have to be in a negative pressure room. Yeah, shingles as well. So a patient requires dressing change from mid-abdominal surgical incision. An appropriate intervention for the nurse to implement maintaining a sterile asepsis field is to A, put sterile gloves on before opening sterile packages, place the cap on a sterile solution well within a sterile field, place sterile items on the edge of the sealed drape, or just discard back packages that may have been in contact with the area below waist level. Yes, D. A patient with severe right-sided weakness and is unable to complete bathing independently. On the basis of this observation, the nurse identifies a nursing diagnosis of low self-esteem, hygiene self-care deficit, altered tissue integrity, or lack of understanding of proper hygiene practices. Yes, it would be a hygiene self-care deficit. Good job, you guys. You have an immobilized patient that's suspected as having atelectasis. It is assessed by the nurse on observation as A, harsh crackles, B, wheezing on inspiration, C, diminished breath sounds, or D, bronchial vesicular whistling sounds. Yes, it's diminished breath sounds. Now you're going to put the steps in order for irrigation of a wound dressing. So with the syringe about 1 inch above the wound, irrigate from least contaminated to most contaminated. Thoroughly dry the peri-wound area with sterile gauze. Fill syringe with solution. Remove the old dressing. Continue until solution is clear. How would you put those steps in order? Good job. So it's DCAEB. Good job, you guys. When turning a patient, the nurse notices a reddened area on the coccyx. What skin intervention should the nurse use on this area? Soak the area with normal saline. B, apply dilute hydrogen peroxide and water mixture and apply a heat to the area. Wash the areas with astringent and paint with betadine, or clean the area with mild soap, dry, and add a protective moisturizer. Good job. It's D, so you want to clean it, dry it, and put the protective barrier cream on it. And what stage is a reddened area? So you turn your patient and you notice that their coccyx is, yes, it's stage 1. What would make it a stage 2?
Superficial.
Right, and the breaking of the skin. So good job. After surgical procedure, the patient is advanced to a full diet. Which of the following foods would you recommend? Pureed meats, yogurt, soft fresh fruit, or cream soup? A is correct. So, because the yogurt will liquefy and cream soup usually has stuff in it, so it wouldn't be just liquid. All right. So you have peristalsis, dysphagia, aspiration. Difficulty swallowing is what?
Dysphagia.
Yeah. exposure. Inhalation of fluid or foreign matter into the lungs and the bronchi, aspiration, and a wave-like muscular movement. That's dollars. All right. And what are the steps to do an abdominal assessment? So you're coming in, your patient's had some abdominal surgery, and you want to assess their abdomen. How would you do that?
You inspect first, and at first you inspect, then you auscultate, and then you percuss, or and the last one I forgot. Palpate.
Yes. So it'd be inspect, auscultate, percussion, and palpitation. Good job. And how long do you usually listen to vowel sounds?
5 minutes.
A minute is 5 minutes is if you hear nothing. So, and it would be 5 minutes each quadrant. So if I go up to them and listen to their all 4 quadrants and I hear nothing, I'm going to listen to each one for 5 minutes, and then I would take the next step. Those are my slides.